Nothing,
Not
okay.
voting.
So, we'll start by recognizing, Ken Nika, President CEO of Memorial. Oh, we are? Okay, I didn't see him, so. All right, I'm sorry, we're gonna start with opening prayer.
All right.
We bow here. Dear Heavenly Father, we'd like to thank you for this day. We're very thankful that you allow us to raise this morning to be able to make decisions for the best interests of the county. We thank you for this occasion, as that you allow us to make good decisions on what's on the agenda that fits everyone. These things we pray. Amen.
Lead us in the pledge.
I pledge
allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, Mr. Nika?
Yes.
Excuse me. Since this is an interim, we need to have a motion to spread the notice on the minutes. That's what we need to
Motion,
do.
right,
that.
call first, motion first and second, discussion, all in favor? Aye.
Okay. Sorry.
There are just a few issues that I wanted to bring to the company's attention, and to this board. I know that y'all have approved the relocation of the health department that's currently in the occupied heart of the diversion center. So I just wanted to get with the board and understand where their mindset was. Pine Belt has been managing the local CSU for a while they have absolutely stepped into it at a time when it was very difficult and very challenging. They got us through COVID. But I kind of want to understand what the future plan may be for that, as well as for the diversion center. Why I have no need or no wants to manage that CSU facility, the diversion center. I am concerned that we need to look and possibly do an RFP for that management of that center, as well as the diversion center. Simply because Pine Belt has done a good job there was the Pine Belt. And I see that their census has been low, not that often due to staffing, I believe. They couldn't occupy all of their beds. So there has been a census or a bed access that was less than the actual beds that it is licensed for. And that's a concern. I continue to hold, I know other hospitals in the area continue to hold patients in their ERs that need mental health help. And it's just so frustrating. And we've been talking about this now for, I think 6 years, at least I've been involved in working with it. It was pre-COVID. So, I just want to understand, I want to be helpful, I want to be informative, I want to be an asset for this board to look to help come up with a solution, especially now that you're putting the county's money into fixing the problem. I want to make sure you have the right management solution as well. Not that Pine Belt may be the wrong management, but is there a local provider? I do know that Gulfport Behavioral Health is interested. They have reached out and trying to get information. And so I know that they're interested. Is that the next step that may need to be looked at, is an RFP for the management of the CSU and the diversion center. So that was one thing I wanted to bring up. And then two is the plan for the health department that's currently located by Memorial. I know that plan has been underway. Not sure the timeline of that. I meet with Dr. Edney and the governor's office monthly, and we happened to have a discussion last month and this month. And he agrees the services that are there may need to be looked at, because the community, the FQHCs, hospitals are also doing similar services. And do we need to duplicate services in markets that's already being covered, therefore not having the need to have such a large presence? But still have a presence, obviously, for taking care of those workers, but does it need to be 10 to 12,000 square feet? So those are two issues I just wanted to bring to the board's attention. Happy to answer any questions.
Dan? you have anything?
Yeah, I guess one question on the health department, did we ever see any numbers of served constituents out of the health department?
I don't have those, but I'm sure they're out there.
Right, just to verify what Mr. Nico's saying about redundant services.
That's the first I've heard of
Me too,
that.
that's why I asked.
Um,
I mean, because if there is a plethora of people that still go to the health department, then either they need to be diverted, or, I mean, we just can't.
So, that's where, like, and I spoke about, you know, he is, because of his past legislation and what's going on with the appropriations, he's very concerned about his budget. So he's looking at which services can he do differently to be more economic and mindful of his budget, so that he diverts his funds to the appropriate areas, such as maternal and fetal care. So one of those services, for example, he's looking at right now are TB testing. So TB testing traditionally, since COVID, has been done by the State Department of Health. It is a service he's gonna turn off. He'll continue to provide that service, but it'll be a cost, just like everyone else is paying. Similarly, are there other vaccines that FQHCs and hospitals, community hospitals can provide, and doesn't necessarily have to go to the health department for? And then he believes that that's already happening. So he would probably share that information with you.
It just seems like if we're providing him with square footage, that's information he should be sharing with us.
Yeah, and
I
that's
mean,
where I
that's-
was
I mean,
going with
technically-
that. Here within the last 3 weeks, and I wish David Hardy was here, we solidified the final floor plan for the health department. We did the diversion center just this week, didn't we, Don? We just shored that up this week, so to kind of give you a timeline. Actually, I have David Hardy, the architect, on the agenda for 5/5 to come give us an update for both of those projects, and we're 12, 14, 15 months out from completing it, because we're ready to go to bid.
Right, but if what you're saying is they don't need that amount of square footage anymore, if they're reducing services, well, then that changes the whole footprint,
That does.
which prolongs us doing anything.
Yeah, I'd be happy to, when I get back to the office, send an email to Mr. Collins and to Dr. Edney, asking him to share that information with y'all in this discussion.
And if possible, I mean, could you come back on the 5th? I mean, so we're gonna have a discussion on that.
I work for y'all, so you tell me when to be here, I'll be here.
So I talked to Kara, and she had mentioned y'all taking on some of those services, or possibly taking on some. How big of a scope of that?
Again, working out a process is really just through the Department of Health and us just saying, for these vaccines, these locations, you can get those vaccines. You know, we have 115 clinics now across the coast,
Yeah.
so access will be pretty easy.
Okay. So it would limit the scope of what they had to do at the health department significantly.
And when I met with him at that space and his department over there, they acknowledged that they didn't need nearly that amount of space. You know, when you go to the local group, they obviously feel they may need more than they actually need. So that may be sort of maybe what happened. But I'm happy to introduce you, Dr. Adney, and kind of step back and let y'all have that discussion.
Yeah, that'd be good before we finalize those plans.
Yeah, before we spend a pile of money. And their side is actually final.
Who is approving the floor plans for the health department? Is it Dr.?
Are you sending it somewhere?
I've been dealing
Jackson?
with Michael Whitehead, and he's been running it on their end. On Heinbelt side, Don, Mona, we had state level people on that call just this week. When was that, Monday, Tuesday? I'm not sure of who all they were, but they were.
That's Brett Hurley, who's over the, he's one of the directors there over the community crisis, area.
Those are the right people. I think Whitehead is reports up a couple of levels to Dr. Adney. So I think that's more localized, although he represents a very large amount on the lower part from Hattiesburg down in the counties.
So is Dr. Edney
answer. He has not, I would hesitate, but I would suggest he probably has not. I would get, he and I talk all the time. Happy to even text him later and say, have you seen the plans for the new office here? Introducing him to you to sort of understand the scope, and you know, the legislative move with budgets and his budget being cut is recent. So that may be sort of a new strategy for him to be looking at those services too. I know he's spoken with the governor about that as well. The governor mentioned that to me this week, that is one of the things he is looking at, which does make sense. Why do we need to duplicate services when it's already in the community?
Any other questions?
I don't think I have any other questions now. I'd like to hear from the others that are here, if there's something that they would want to add to it, maybe create more questions.
I'm fine, I had some of the same issues that Nathan mentioned.
Is there anyone else, any of the agencies that wants to say anything?
Kevin, go ahead.
I can talk after you, go ahead.
Well, just in saying that, again, this is a little bit of, wasn't sure why we were coming here this morning, but, did not know that this was in the plans of being asked, but we are and have been full staff at CSU since April the 21st, we went back to full capacity. Yeah, and so the CSU is actually not a Harrison County CSU, it's for multiple counties. And it is going through Department of Mental Health, and that's where the funding for it does come from. Part of the reason we did go down in numbers to 12 at the CSU was because in response to House Bill 1640, we started taking away more aggressive individuals, and we had some staff who got hurt. Some who quit because of that, we had to replace them. But we are fully staffed at this point as well. To my knowledge, in our data, we only denied 2 people in that whole time due to the staffing issue, and I don't know that they were from Harrison County either. And we are, again, up and running, have been going. In fact, we were very low this week because there weren't the referrals in there too. The CSU, again, is multi-counties. It's part of the whole state process. It's not a one county thing. And the diversion center, you're right, Bobby, we did get all those plans done this week. We were able to make sure they got honed in. The funding for the diversion center, as y'all know, we have been through the state, through the legislators, 1.2 million is part of it for the operating funds. There's 1.9 that's ARPA funding. And obviously that is going to be going away soon, and by the time we get the building built, it probably won't be available to 1.9. But again, got the building going. What else is, we've been working with y'all this whole time to be able to get it done, so appreciate the opportunity to speak to this. Kevin, you may. What's your name? Mona Goethier, G-A-U-T-H-I-E-R.
And what's your address?
P.O. Box 18679, can I think of that? Hattiesburg, 39404.
You need all that from me as well?
We need
Kevin Felsher,
your birth date, social security number.
Bank account number?
Social,
Felsher, F-E-L-S-H-E-R.
okay.
Address 426 Sam Lene Court, S-A-N-L-E-N-A-Y Court, Biloxi, 39531. So this meeting has kind of caught me off guard. Just found about it yesterday. Had no idea there was a problem still, or that was so emergent within our kind of mental health system. My question to y'all is, has there been an obvious problem that y'all been aware of that warrant such a meeting as today?
Not that I'm aware of, other than which Mona got involved. I just had a question about why we were only accepting 12 instead of 16. And then she answered it, promptly. That's that's the only thing that I've seen, that I've directly asked for information and I've gotten.
Sure. Well, having been a part of these meetings that Kent has mentioned that we started back in 2019, I've tried to attend every one that I could. And as of late, I've not heard of any problems. Now, I have contacted the Department of Mental Health, and there is some question as to whether you could even do what's being proposed within reference to issuing an RFP for CSU. While that's not a core tenet of what the region has to provide, it is state and federally funded, and it serves multiple counties. The state mental health coordinator, from my understanding, Bill Rosemont, has said it's absolutely considered a core tenant. And in that way, you couldn't RFP that out and try to break that out from what the region's doing. So there's a question whether you can even do that. Now, the CSU, that's still, you're getting $1.2 million from the Department of Mental Health and that state money. So I don't know if you can arbitrarily just say, well, we're gonna RFP that out. Those are questions you need to look at and get answered before you proceed. Look, I'm for what's best for this county. I think, and I thought that Kent, Dean, Leonard, and Pine Belt was working to shore up our safety net of mental health for Harrison County in this region. And the fact that this meeting was kind of called and they were blindsided, I'm not here to defend them, but it's just obvious that they had no clue to why this meeting was being called. It's a little bit troubling to me. We're supposed to be working as a team. When we toured in Kansas City, I forget, Leonard, you came. Sheriff was there. What did we see? Teamwork. I mean, it was an absolute team. It was all hands on deck. And again, Harrison County, here we are again, kind of left hand doesn't know what the right one's doing. I hope we can do better than that, and we'll work together. Again, if Pine Belt's falling short, I'm all about calling them out, seeing if they can correct the deficiencies, and if they can't, we have to look at another option. But how are they falling short, and what can they do about it? Fine. But just to call a meeting where I see no clear evidence of how they're falling short seems a little bit arbitrary.
To answer your question, the only conversation that I've had, I can't speak for the other board members, has been on the health department side. Mental health, I thought that this was about the health department.
Okay.
Because that's the only conversation that I'd had.
And I will say to y'all, as vice chair of public health for the state on the House side, that anything I can do in conjunction with Kent to help y'all, if you run into any stumbling blocks or obstacles or impediments, I'd be happy to work in conjunction with Kent, with Dr. Edney and his team. We have a really great relationship. Be happy to help any way I can on that. But to put a bow on the mental health conversation, I will stress, I think we need to work as a team. And I think that would serve all our citizens better. Thank you.
So when I walked in this morning, I didn't know this was an official meeting. I actually went over there, to be quite honest. The conversation started because there has been a period of time going back to, I was trying to find my email, probably 9 months, when it was advised to have information shared with Gulfport Behavioral Health that I believe Dean has requested information from Mona, and to this day is still not getting that information. That conversation came up 2 or 3, maybe 4 weeks ago. I said, well, my concern is that there haven't been staffed up to the full 16 in probably over a year until recently, to April, you're saying?
That's not true.
I have stats here going back to at least to November of 23.
You had a few weeks at that time.
Okay.
We got them up, we've been going, and this has just been
That-
January of this year.
Again,
So it has been
the data's the data, and look, y'all have done a good job. My concern is that for multiple months, we continue as a county, and you're my owner, so I'm here just to share information, continue to support a full bed of 16 census that you pay for. You also pay for members of our community that go to Gulfport Behavioral Health and to Oceans at a significant cost. My question is, when you have a census ranging from, I think this week it was 5, and then others, going back March 10, 8, 11, 12, 9, 8, 7. I mean, the concern is, I know how I have to run my hospital. I need to keep my beds staffed. Sometimes I have to pay for contract labor to staff those beds. While I understand the economic cost and what that does to a budget, back then, when there was a need, that wasn't necessarily being done at the CSU level because of staffing issues, and it is a problem. But I had to go above and beyond to take care of the community. My concern was that that wasn't being done at that level as well. And is that a funding issue of which you're paying for from the county standpoint, and those funds are not necessarily kind of giving back to you because we're not spending it. I want to make sure that those funds are being hit here for the county CSU, Hancock, Harrison, I think Pearl River, right? Is Pearl River still part of ours?
It covers 18 counties, it can. It's a statewide facility, but primarily Hancock, Harrison, and Stone go to it.
But aren't they paying the majority of the fees, aren't they?
No.
Again, there's a problem, ERs are still holding them, the CSU is not full. My concern is that's where the problem is. And we're continuing to divert to ocean and to go over mental health at cost to y'all. So I just wanted to bring it to your attention. Not a problem, they have done a good job. My question is there an alternative? All right, that's all. And just, I just had conversations, I didn't know there was going to be a public meeting.
Well,
I walked in this morning thinking, oh, okay.
The reason it's a public meeting is because if more than two of us get together, if there's three of us, it's required.
Yeah.
Because we can't
Yeah.
Discuss official business with more than two
And
of
I
us. 'Cause
understand, I understand.
for
I didn't know.
quorum, so.
I just thought it was a meeting with a couple of y'all, that's why we didn't have to have a public meeting.
Yeah, I don't think it's anything contentious on our part. We're just trying to, I guess, get everybody together, try to make sure that we got it, all our ducks in a row.
Look,
And I'm still not sure about, how long we've been somewhat understaffed, the bed hadn't been full. You're saying one number and then you can't think of another.
And I also have Chelsea that's back here, she's my commitment clerk that works with, CSU, Memorial Hospital, I think, how many people are being held in ER that's not being sent over to CSU, do you know?
I mean, as of today,
As of today.
there's only one.
Last week, we've called and they didn't
Yeah.
have any to send.
Yeah, the census is low, just, because of people, unfortunately, don't get sick during the holidays.
Well,
It's essentially just believe it or
we can't
not.
create people to put in our CSU if they don't.
No, and again, we're all low this week, y'all had 5.
And we saw that the census was being low, and I know for a fact that my coordinator reached out to Chelsea, reached out to Hancock, the local chanceries to see if there was anybody, and we even reached out to Memorial. I met with Sue 2 times since October, her and Michael, and just to be able to improve that communication in regards to let's get them back into and do that.
And we also set up meetings to have your local social workers that are on the ground come, they did not come to the meeting, so unfortunately, we weren't able to get that.
Mona, this is not about pointing fingers. This is about me trying to get better care for our
I
community.
understand that,
Because
we
there is
want to
still
do
an
better
issue.
care. So if I can, the information that Dean Godey asked was what is our per diem rate? And I asked him to share his with us, and everybody was on that email in terms of, as Kevin said, this is a community thing, so let's see how we could pull together. Frankly, we've been doing other things in getting this going, so giving him our per diem rate is, it's on my list. The other,
Yeah.
yes, there was twice that we had gone down in census. But even in both of those times, the referrals were not there. We didn't turn down ones that came in. So we were down in census, but it never got up to what we were at anyway. But we are back up now. We are willing to do that. And again, we have been calling the ERs, Memorial and the others, when they are low in census to say, do you have anybody? Do we get them in? Trying to make sure we do that as well. And I think everyone in this room is on the daily emails that we send out with the census so that you guys know that.
Chelsea, we need to add Tricia to the daily census.
I'm not aware either.
And Robbie.
I get that email.
Rob is on that too.
I
And
think
it is on
sometimes
that
it's more-
email, how many are Harrison, how many are the other?
I think sometimes it's more than one a day that we get.
Yeah, I think think you'll get one from CSU, and then
Yeah.
Chelsea turns around and sends out another one, so you may get multiple ones.
Okay.
Okay, I don't know that we're on the second one that gets sent out, so are we? Okay. I don't think I get that one, but I guess Carrie, you do.
I get it.
And
Ellie
then-
definitely gets it.
She's
And
just
again-
forwarding the information that y'all are sending.
Exactly, yeah, definitely trying to share the information, share the data, where is, an opportunity to be able to serve someone else there too, and we're all for that as well.
Yeah, I just wanna get a better understanding of, on the staff or whatever. I mean, how long has that been happening? I know we have a good explanation, but that's just a little concerning.
Well, it
Do you
happened
have those numbers?
twice since we've been there in 2021, and we are using, the locum tenens staff there. So we have been doing that, and we eat that cost frankly, because it is important to get it staffed as much as possible. We have to get staff that are, we've got to train them. We're taking on more and more aggressive folks in 1640. And so we want to make sure we have the right staff there too. So it is, it's been twice. Now, this last time was January to the April one before we were able to get more of the CAs and the nurses and stuff and get them in there as teams. But that's the second time since we first started in 2021. And you guys have been informed the whole time too.
Yeah, for the aggression part of, didn't we, a few years ago, hire some security or safety?
We do have
for them?
security,
We
yes.
gave them, we give them more money. We gave them additional funding.
Right, so that's not an issue there,
We
for
do,
your aggressive people.
we get from the county the same 2.146. So, there's a grant through Department of Mental Health. That was an extra amount of money to help with the security. So yeah, we've got that. You just have more folks that are coming in there that are, there's drug and alcohol issues too. The ones that we do have that we are not able to take are severely have medical issues, and they have to be cleared. And then also someone is so aggressive that we can't handle them there, but we've handled more aggressive folks there, as has every CSU in the state, because again, it's, kind of that mandate that's come down for the whole state. And, we're, have daily conversations, I think, pretty much. Angela, if there's something that we're not doing that you need, you have a cell phone number, and these guys talk too. The other thing about a CSU being attached with the mental health center is it's not just a CSU crisis service that you get. They get connected to all of the other services that are in the mental health center from there, pre and post. So individual therapy, doctor services, continuing, high-risk programs after they get in there to meet with them, even daily, multiple times a week if needed. And all of those are part of the community mental health center process, that continuum. They don't get that if they're in a hospital or something. In fact, when they leave the hospital, lots of times they come to us for all of that follow-up. So it's a continuity of care thing as well.
I guess one, through the conversation that Mr. Deku had, that brought a question to my mind is, when we create this diversion center, if you're not able to maintain employees for the CSU, how much harder is it gonna be to do the diversion center? Because the people that are gonna be coming there are probably gonna be of the same combative, and if you can't get them for the CSU, how are we gonna manage this
Well,
diversion center?
And that's and we've been transparent about that as well.
Yeah.
That is something we will have to work with, but the ones we will have to hire will be the same ones anybody else will have to hire as well.
Right.
The folks that come through there, the difference is going to be, they will be brought there by CIT officers. And so they'll come in, and some of them will be able to be stabilized within the 23 hours and then go on back. The others that are not, and they need a few more days, they'll be able to go into the bed part of it. And there's also a couple of swing beds for if they can't be, if CSU doesn't have the beds, they can use it for that as well. Staffing around the nation, around the state, around everywhere for mental health is difficult. I'm not gonna sit here and tell you, oh, I have it right there, I've got all these people, because
I would say across the country. Right?
it is nationwide.
Well, I understand that, and when you're gonna be, as it appears, tasked with doing it, that you have a plan, and that how are you gonna execute it to find these people? I understand they're hard to find, but when the county makes this commitment and puts this amount of money into this diversion center, the last thing we want to say, well, we can't put people in it that can run it.
Absolutely, and we've been straight from that from the beginning. Kit would have to say the same thing to you because, or
Right.
Dean Godey would have to say the same thing to you. Honestly, he hires our staff or we get some of theirs and it's the same people that kind of go around. But then, yeah, we have a plan, we have a time to do it. I will tell you too, 1.2 million is not enough to run the diversion center, but it is what we've been writing the grant for since
Right.
2021. And, again, I'm not gonna sit here and tell you I have it fully staffed right now, because first of all, that wouldn't make any sense.
Yes, I understand.
But yeah,
And then
and
the
whoever
other,
does it, it's gonna be a challenge.
the other question that I have is how is there gonna be, if possible, a defined line between the CSU and this diversion center, because the diversion center is gonna have beds too. So how is that line gonna be defined between the people in Harrison County just being in our diversion center and not utilizing the CSU where?
Well, Harrison would still
I
utilize the
understand, but
CSU.
depending on where you've sent them, it's based on who's in it.
No, the diversion center is just Harrison County. And
Correct.
that is Matt and all their folks bringing them to the diversion center. Again, that's only Harrison County. And if there's a CSU bed that's needed, it would be a Harrison County CSU bed. The
Yes, ma'am.
CSU would run the same way it is now. Pre-affidavit screenings, they go through the courts, court puts them
Okay.
there. So it's not a CSU.
So there's a defined line between.
Yes.
So we should
Yes.
never see where people should be at the CSU, but yet we're sending them over to the diversion center in order to make.
Correct.
Okay, I just wanna make sure that there's a line
Now,
between these two.
You may have someone that comes through the diversion center
Right,
and they're not getting better, and so we think, hey, we do need to do an involuntary commitment, and we
Right.
get with them, and then they would go to the CSU or state
Okay.
hospital, yes, but it shouldn't go, it's not gonna go the other way
Okay.
around.
Leonard? While he's coming up, I want to recognize Mayor Hughes. Saw him come in a few minutes ago.
Leonard Papania, Ocean Self Care, 5360 Legacy Drive, Suite 101, Plano, Texas.
Can you spell your last name for me?
P-A-P-A-N-I-A. And I apologize for my attire. I did not realize this was a public meeting.
You drove a long way to be
I
here.
did. I'm gonna drive a long way when I
reminds me of
leave.
Merlin flies into the Bahamas, and, whatever that cartoon was.
No, I want to start with the question. One of our marketing people from our Biloxi Hospital attended is Supervisor Powers on?
No, I thought that she was gonna be, but I was wrong. I
Then
think
you may
this-
or may not be able to answer my question. It's my understanding during a presentation
She's not on here, is she?
Yes.
Okay.
Supervisor Powers had indicated that the CSU was going to be closing.
No, I
I
don't
heard
know.
that.
Okay,
If that was the case,
I heard that out.
I think that was misspoken, because I don't know anything about that.
Do you know which location she's talking about?
we only have one CSU.
She must be talking about region 14.
She must have
14
been talking about
Jackson
Region 14 maybe closing.
Okay.
But not the CSU, no.
Okay, so, and much like Kevin spoke of earlier, I've been tracking this conversation for a long, long time, all the way back to when I was chief of police. And it's my understanding now, the model is going to be then, you're keeping a CSU intact and you're bringing a diversion center online, correct?
Yes, sir.
And you all, and I mean this with the utmost respect, have a clear understanding of what the services of a diversion center is. Because it's not interchangeable, and Mona, you can jump in if I'm getting any of this wrong, it's not interchangeable with the CSU.
Correct.
That diversion center is there for someone who is not quite in an acute phase where they're a threat to themselves or others and they need immediate inpatient.
Yes.
The whole premise of that is to divert them out of his hospital beds, and really, it's not healthy for my company either, but it's good for society. We divert them from going into that. And so this diversion center is going to be on Seaway Road.
Yes, sir.
Okay. And it's going to be a single point of entry
Yes, sir.
for law enforcement from what counties?
Harrison.
Only.
Okay. yeah, then I need to follow up with Supervisor Powers on,
Yes, sir, my understanding with the diversion center is that the entry is more of like a home setting where someone, like you said, is not maybe to the point where they need to be admitted or acute, that they can come in, get the attention that they need, maybe some medication. It's not necessarily a room as much as it's a place for them to come and get the help after they're dropped off, and or if they need to be admitted, then there's rooms there.
right.
But it's not like the CSU. I understand the difference between the two, but the model I think I was told was it was like a home setting with couches.
Yeah,
recliners.
it's up to 23 hours of service,
Right.
and there's a lot of people that if you catch them in that phase before they go acute, you can
Yeah.
really deter. So then this raises a question. So only Harrison County is going to use that as a single point of entry? When officers are encountering these individuals, I guess that's what I'm not clear on, because statutorily, an officer has authority if they are CIT trained, if they've attended that 40 hours of training. But for them to act on that statutory authority, they have to see certain things that I question. Does that go beyond what the diversion center is able to attend to? Because if somebody is a threat to themselves or other, are we telling police officers they're going to bring them to this diversion center?
For Harrison County, the CIT officer can bring them there, yes.
And so in those instances, how will that play out with the individual?
The individual will come in, we'll do the full set of assessments as well. They would need to be medically stable. And then whatever their needs are at that point, then that plan goes into place. Either they start on medication immediately and they can stay a few more days at the bed there until they get more permanent status if they need it somewhere else, which may be a CSU, or we're able to get them stable there and get them into one of our other high-risk programs that we go see them daily, kind of
Okay.
on an outpatient level.
So one of the things that we need to contemplate, and I understand we're saying it's for Harrison County only, and I get that. However, if a police officer is in the field and they are engaging with somebody who the officer recognizes the solution is the diversion center, are we putting that on the police officer in the field to make determination of their residential status before they use that diversion center?
I would say, we run into that issue now, and I believe, but I would say there's no way, I mean, we can't ask them if they don't have identification or they don't, they're not of mind to be able to tell you where they live. We can't just not do anything with them, but I would say we'd have to take them with the diversion center.
Yeah. Well, and the only reason I'm bringing it up, it sounds like it's the will of the board that they want to limit it to Harrison County. I get it, but I think it will make it very difficult for those officers in the field, if they have to do that. And then
there's a sense of urgency too when they're in the field like
Yeah,
that.
yeah,
They're not gonna
and I will tell you, I
try to get to the bottom of where the person lives on a regular
I deal with
basis.
officers in Texas where they have to find a payer source before they can bring them, and they're with them 12, 15 hours and driving them hundreds of miles. We're so close to something good. We never had a single point of entry.
Right.
And I think this board has been very courageous in taking this on and working with Pine Belt on it. And I think it can have a tremendous impact on how we do business and mental health here. I just, we need to be cautious as we make these approaches.
Yeah, and I think once we get it going and we work through some of those issues that we may take patients that aren't from the county because they're humans and they need the help.
Right.
That maybe it is something that other counties can jump on and say, hey, look, we want to contribute. Is this something that we can be a part of, just like the CSU numbers? I don't know, but I would be open to having other counties participate and let their, if it works out, once we get it going and it seems that we can handle that extra capacity,
Right.
that we can all, the whole coast can come together. I don't mind that it's in Harrison County, but
Right.
if it can benefit everyone, as long as we're all contributing, the counties are contributing
And I
to
think
the
that,
positiveness.
I think the only other point I would make, and it's just something we need to be conscientious of as we move forward on this. So you have this single point of entry, and to your point is, because our reality is, if other agencies know we have this, their people are gonna start appearing in our community, and we're gonna start handling those. And if our diversion center is successful within hours, these people are gonna be exiting. A lot of your population in there is going to be homeless, and when they exit on foot, their starting point is right there in that area. And there's going to be an impact in that area, and it's not necessarily the burden of the Board of Supervisors to figure that out, but there's probably other players you need to start pulling to the table and having those conversations, because you're going to start to centralize a lot of these individuals that are having those challenges.
Yeah, and I do see where we're gonna have like those challenges and others that are gonna crop up, and we're gonna have to come up with ways to.
Right.
There's some that we probably don't even know today.
Yeah, again, and this is probably not in my capacity as Oceans, it's just being from here and being involved in this so long. I would probably, Kevin and I were talking historically, we were meeting more on this.
Yeah.
And it was a lot of conversations, and sometimes when we quit meeting, things bubble up, and misunderstandings occur, and we have to regroup. But as you're getting closer to turning the key on this diversion center, I think sooner than later, I would maybe start identifying those other people you need at the table. Because as you solve one issue,
Right.
another one's gonna be created. But that's all I have. Thank you.
Mayor Hughes, do you have anything?
No, I think this is an important conversation. We're at a crossroads. We all know this as far as the growth of our population, and a lot of us are at our wits' end. I just left the mayor's conference, and every mayor I talk to across the country is dealing with this. This is not unique to us, but it is a serious problem that we are encountering, and our residents expect some results. We really need a larger discussion on where a more, I don't want to say permanent solution without getting into the housing business. Those models don't work. But some sort of transitional deal. Leonard's point about where you put it. You can't put it near neighborhoods. You can't put it where population centers are. You can't put it where retail is, because these folks will stay there and they will harass and aggress people without any direction. We want to be able to get them the opportunity to get where they came from, or where they need to go, or get them help. And there is no perfect solution or perfect place, but there are partners in this community that can help us find solutions. I'm thinking Justin with Region 8 Housing Authority, he's got some ideas on some things. We just need a larger, more defined approach, for lack of a better term, and pick up where things were left off when we did have a good coalition before COVID screwed everything up. So we need to kind of pull it back together and get some focus on where we want to go. Pick a spot in the county and start investing. I think it's going to take that to get folks basic services and then get them on their way, but out of our communities as much as can be done. We also have to have a real serious discussion on where we're going to locate soup kitchens.
I agree.
These are uncomfortable. Anytime you deal with mental health, every case is different, and there's a lot of that, there's a lot of drug use, but we're piecemealing it right now, and that is not a good approach. We've got to have a uniform solution that is a bit removed from our population centers.
Yeah, I agree. It does create a problem. I've seen it in Biloxi. They stay within a certain distance of where they're getting those services at, and where they're getting those services at most of the time are in the general area of a large populated area of the cities, and so.
Yeah. Most people who deal with it get it, but it impacts our bottom line as a county and as cities. A lot of these folks, particularly if these areas where services are provided are the same place that tourists go, they aggress people around restaurants, around entertainment areas, and tourist visitors, locals will not go there, and over time it becomes a real problem. And the bottom line is affected, business is shut down. The churches who benefit from the tithes, they go down because nobody's making as much money in some of these areas. And the churches have to be a part of this discussion too. And some of them don't want to be. They want to do their own thing. And it's better if we find a way to collaborate with those interested parties who really want to make a difference in those less fortunate. Easy to say, hard to do. We gotta have a concerted effort.
If I could say a couple things in closing, I did miss some of what Leonard said, Department of Mental Health called. There is some question as to whether, if it rose to the level of having to take over the CSU portion from Pine Belt, whether that could be done, there's no real clear answer. They think no, but they would be willing to look at it if it had to happen. I want to recommend that we get back to meeting. I don't like meeting just to meet, but to me, since I've been involved with the Board of Supervisors, in the Sheriff's Department, one of the biggest issues that y'all have repeatedly is mental health. And it always seems to be something that you're having to deal with. I do think it's something that the left hand should know what the right one's doing. And I would be more than willing if we could just meet once a month, if y'all would pick 2 supervisors to lead. I think for a while it was Rebecca and Dr. Ladner, and then Supervisor Cuevas and maybe Dr. Ladner, whoever it is, doesn't matter. If we could just get 2 supervisors, Angela and her team, the Sheriff's Department, and then all of our stakeholders that we identify that need to be there. And it's not a complaint session. It's a, here's where we're at, here's what we're doing, here's what the needs are, here's where our gaps are, they need to be filled, how are we gonna fill them? To keep a more, homeostasis kind of setting for our mental health in Harrison County. So we're not falling into crisis. So I would recommend that we get back to doing that. Kent was leading the meetings at first. Doesn't matter to me who leads it. I
Really
understand.
happy to host them as we were doing at Broad Avenue.
That's where I thought, well, the meetings that you're referring to that have ended, we really weren't as much as a part. I knew that y'all with Troy and
Yes.
Leonard, y'all were meeting on Broad Avenue.
Yeah.
And I guess that's the meeting you're referring to, Kevin, is the ones that they were having there?
Well, it started at Gulfport Memorial, it kind of
It moved to Broad Avenue.
moved to Broad Avenue, and
That's the
then,
one you're talking about, where we used to have a meeting. That one? Okay.
yes. I would recommend that. It's 12 meetings a year to ensure that everybody knows what's going on within the mental health realm, that we can be partners, and I think it would be productive on all fronts. So I'd recommend that. Number 2, I didn't hear a lot of what Leonard said, but I want to emphasize, the diversion center was a single point of entry. It was more to take the pressure off the hospitals and to help law enforcement, so they weren't tied up for 2, 3, 4 hours with a mental health patient that they were really not equipped and supposed to be dealing with. They could get them triaged, and then Pine Belt could take it over from there. So another component of that diversion center, though, were emergency beds, because remember when we first had this conversation, we had overflow. It's not a problem right now, and it hasn't been, but we were topping that 16-bed threshold, and sometimes when they were short-staffed and could only do 12, we were exceeding that. So if I'm not mistaken, 2 of those beds were always going to be for overflow for Harrison County only from the CSU if that became a problem. Again, not so emergent now. And one thing I want to reiterate is that 1.9 million of ARPA money will go away, I think in October of 26. So we're going to lose that if we don't finish in an appropriate amount of time and are able to take that back. And the Trump administration has been clawing back some funds here and there. Hopefully that's not part of it. But just keep that in mind. I wanted to make sure we were on the record as known we are on a hard and fast deadline on that ARPA 1.9 million. The 1.2 million from the state is going to be there, from my understanding, perpetually, and we're good. But that 1.9,
It's
not
just
so
a
much.
one-time deal.
Yes. So
We need you to get that to where that's perpetual as well.
yeah, okay, sure. Well, my last name's Trump.
I guess going forward with,
Thank you.
once we figure out what square footage is needed for the health department, the diversion center, my understanding is on the bottom floor to one side of the building.
To the left side.
This goes
And
back
the
to,
building is located on Seaway.
correct, this goes back to setting expectations. Can we not have a contract for them to expedite getting that done?
Yes.
It just seems like we do contracts for 12 months, 2 years, and I just for the life of me don't understand how things take that long.
So we discussed that this week. It's a cost option, so a shorter contract will more than likely cost more, a premium for the expedited. Again, we have not sent it to bid. We can discuss that with, Dave Hardy, on the fifth. But he was gonna weigh the cost options, do two variations, a shorter term and a longer term, and look at cost between those two.
I just think that the shorter term should be, we need to change that bar on everything we do. Everything just seems to take way too long, and I, again, don't understand it, and I think it can be reined in. We just have to accept the people who wanna bid on it and wanna do it in that range, and the companies that don't, they just don't. I mean, the contract construction company don't wanna do it in that time frame. We'll work with the ones that want to.
And we need to get whoever's involved with the square footage, because every time we make a change, he's billing us.
And it drives
So here
it
we
out.
are, another change, because now we don't have the
Yeah.
footage correct on the.
On that health department side, though, if what Mr. Nico's saying is correct, I mean, it bothers me to go in and build this big elaborate, have this big elaborate build out that's not needed. And then down the road, what we're going to end up doing is when we see it's not being used, come in and have to tear out and rebuild again. So we need to get it right the first time. I know we've already got plans drawn up, but we need to get that right the first time so that we don't spend unnecessary money coming back and correcting it later.
Yeah, and I would say that if the diversion center needs to be spun off and be separate so that it can be expedited and completed, then I would say I wanna know what that option is. Take and put a brick wall down the middle of it, and that construction has nothing to do with the other. If it takes, of course, I wouldn't be satisfied with that either, but if it takes 12 months for them to do the health department, I don't want 12 months for a diversion center. I want 6 months. I don't know, but those two timeframes need to have a gap between them that's very impressive.
And Ken, are you gonna get with Dr. Edney to get with the other guy that Robbie's been discussing to make sure that they're on the same page?
I've
Because
already confirmed that Eddie has not seen the plans, but I'll let him know that after this meeting, I'll connect Robbie and him together to share the plans for the services.
I think the extra money that it would cost, and to be sure that we meet any deadline for the ARPA money, it would be money well spent to expedite that and get it done. I mean, we're gonna have to have 3 ribbon cuttings, it's been so long.
Anyone else? Anybody else got anything to say? All right, need a motion to adjourn?
Second.
Discussion, all in favor? Thank y'all for coming. Everybody wants to-
Mr. Mayor, you good?
I'm good, yeah. How about you?
Yes, sir.